Hi, I'm Dr. Susan Kaweski. I'm a board-certified plastic surgeon and I'm working at La Mesa Surgery Center this morning. What I am going to talk to you about is BodyTite. Today our demonstration will show how this amazing machine will be able to generate radio frequency energy in order to coagulate tissue and also contour the body in a more effective fashion. So let's go meet our patient. Our patient is a 38-year-old who has excess deposition of fat and excess skin in this area of her flanks. So this area is an unwanted fat deposit that really cannot be controlled with diet or exercise. So with BodyTite, we are going to concentrate on this area. Now what I'm going to do is, first of all, mark the area. So now we're marking the flank. We're going to perform our pinch test. And a pinch test, again, is 8 centimeters. So the patient has deemed that this is the adequate area that we are going to address, and now we're ready to go into the operating room. So we're here in the operating room under a general anesthesia, getting ready to do the first part of the procedure, which is infiltrate the area with tumescent solution. Now, this solution contains lidocaine, which is necessary for a little anesthesia, local anesthesia, and epinephrine, which will cause the blood vessels to constrict. Thus, there will be very little blood loss during this procedure. The first thing I'm going to do is mark an access area for our placement of our tumescents. So we'll make a very small incision. And then we'll be able to gain access to the site with our tumescents. All right. So now we're infiltrating with the tumescent solution in the areas that we have previously marked. The reason this is very important to do this is because basically it expands the adipose layer, the fatty layer, and causes the fibrosepty network to be put on stretch. And that's going to be important for the radio frequency energy to penetrate. This is the BodyTite handpiece. It has an internal electrode and an external electrode. The internal electrode generates the radio frequency energy and is transferred to the external electrode through the adipose tissue. This is meant to coagulate all the soft tissue, including the fibrosepty network, which is important for contracting the skin. The device has a control on it, which are numbers from 1 through 6. Now, in our preoperative evaluation, we determined through her pinch test that she was 8 centimeters. Half of that is 4 centimeters, so we know that the depth of the device will need to go to 4 centimeters. This means that the internal electrode will generate radio frequency energy 4 centimeters away from the external electrode. We will then continue to 2 centimeters through the tissue and then finally 1 centimeter in order to coagulate all the fibrosepty network. So first we put a little gel on the area to allow for glide of the machine. All right, and we will begin. This is called a stamping approach. It allows for the energy in the internal energy to increase to 70 degrees. And you can hear by the machine that it's reached temperature with a staccato sound. Now we'll move to another area. I've now adjusted the handpiece to 2 centimeters. That means the internal electrode will be 2 centimeters away from the external electrode. So we are moving up through the skin. We've started on the other side, and as I'm placing the instrument in, you'll hear the staccato sound, which actually protects us from any temperature surge and allows us to know that the internal temperature has reached 70 degrees, which is our cutoff. That prevents us from getting any burns. You can hear the popping sound, which tells us that our fibrous septi are being coagulated. So the third step is to do the lipoaspiration. And as you can see, the fat is yellow. There's no blood in the fat because we've already done the coagulation with the radiofrequency energy. And that's the beauty of this machine. There will be less bruising on the patient, less discomfort because of the coagulation. So now we're going to do the anterior flanks, and as you can see, just from what we did posteriorly, we have a collection right in this area anteriorly that we will address. So we're going to proceed with the tumescence first, then followed by the BodyTite, and finally the aspiration. So we've completed the liposuction, and now we're just getting rid of the excess fluid. So Dee Dee will go ahead and roll the skin, and we get out the fluid. And we try to get out as much as we can. Okay? So we do that for all the areas that we have liposuctioned. So all incisions are then closed, and Masticel and Steri-strips are applied. Rest-on foam is then placed over the areas that have been liposuctioned, and then we place her in a compression garment. So here we are in post-operative day number 1, and I'm going to ask you how you're feeling today.
Feeling really good, just a little achy, but nothing major.
Okay, so I'm going to go ahead and remove the garment. You can hold that there. So you can see that we've put the rest-on foam from yesterday, and she has very minimal bruising. Let me have you turn. Very minimal bruising at all. Excellent. Okay. So how are we doing today?
Feeling great.
All right. How about the areas where we've done the BodyTite on you?
Most of them are pretty soft. There's just a couple areas that are still a little hard, but they don't hurt. So it's just a matter of it just kind of softening up. But for the most part, I feel pretty much back to normal.
Okay. Let me have you turn for the camera to show in the back where we've done all of the work here. So as we have seen with our patient, soft tissue contraction with aspiration can lead to very pleasing results with BodyTite. Areas of skin laxity such as the abdomen, the inner thighs, the upper arms can all be treated with BodyTite and get these exceptional results. So look into BodyTite. Give us a call, 619-464-9876. Looking forward to talking to you.